Hi, and welcome to the Affordable Care Act, Competing for Customers, a Take 30 with One-to-One Media webcast sponsored by Teletech. I'm Tom Hoffman at One-to-One Media, and I'll be the moderator for today's discussion, where we'll be exploring how the Affordable Care Act is effectively forcing healthcare insurers to become more customer-centric and best practices for helping them to achieve these goals. Our featured speaker today is Ingrid Lindberg, Chief Customer Experience Officer at Prime Therapeutics, a pharmacy benefits manager in Eagan, Minnesota, which serves more than 23 million customers. A 2011 One-to-One Media customer champion, Ingrid is responsible for building the Voice of the Customer program at Prime Therapeutics and improving the customer experience. Prior to joining Prime Therapeutics, Ingrid was the Customer Experience Officer at Cigna, where she was responsible for implementing and overseeing the company's customer experience strategy that was used to help manage its relationships with its 65 million customers. Ingrid, thanks so much for joining us today.
Thanks for having me, Tom. Excited to be here.
So before we jump into the discussion with Ingrid, I'd like to offer our attendees a few pointers on using the On24 tool. First, please turn off your pop-up blockers to enable a survey that will be provided during the webcast. We'd encourage everyone to participate. If you have a question for one of our presenters, please click on the red Q&A widget, type in your question, and then hit submit. If you encounter any technical issues during the webcast, please click on the help button that's located near the center of the toolbar. Also, feel free to tweet about today's webcast using the hashtag that's shown here. Now for a bit more background on the key points that we'll be covering in today's discussion. Today, Ingrid and I will examine how the Affordable Care Act impacts how healthcare insurers will need to address the customer experience. We'll also explore different techniques that healthcare insurers can use to gather and act on both customer and prospect data in order to deliver relevant messaging and offers to them. Finally, we'll consider steps that healthcare insurers can take to meet customers' high expectations for receiving exceptional service and care. This will be followed by a Q&A with our attendees and a post-event survey. So as most people know, the Affordable Care Act, also known as Obamacare, was signed into law by President Obama in March 2010. As part of the new law, all Americans are required to have health care insurance by 2014 or face financial penalties. What this means is that, according to various industry estimates, between 30 to 50 million people are expected to flood into the market, and the majority of these people haven't had health care insurance before. These changes carry serious repercussions for healthcare insurers. Healthcare insurers have historically worked with employers to add or subtract new members, so they really haven't had to market directly to consumers very much in the past, or for that matter, to be terribly customer-centric. It's kind of like what it was like being a customer of a power utility 20 or 30 years ago. As a customer, you were locked in with the utility, and they didn't have to go out of their way to provide you with an exceptional experience or service. But that's beginning to change now for healthcare insurers. Over time, a growing percentage of consumers will be purchasing healthcare insurance directly from insurers. And while insurance companies are required under the new law to offer healthcare insurance to anyone who applies for it, regardless of pre-existing medical conditions, they'll also be offering customers tiers of coverage. This will range from basic coverage all the way up to premium care. So because of these changes, competitive forces are going to require insurers to learn as much as they can about individual customers and prospects as they look to attract and also retain the healthiest and most profitable customers that they can. Insurers will also be looking to leverage customer and medical data to provide stronger incentives for consumers to adopt healthier lifestyles, since Let's face it, healthier customers typically equate to more profitable customers. So today we're very fortunate to have with us a renowned customer experience leader in the healthcare field who is well versed in these issues. Ingrid will share with us a much deeper understanding of how the Affordable Care Act impacts healthcare insurers, along with best practices for meeting the heightened expectations that today's customers have. Ingrid, thanks again for joining us.
I was super excited to be here today, Tom. It's an exciting time to be in healthcare. You know, we've got 50 million uninsured Americans out there, and that tide is going to be coming at us starting on 1/1. So excited to talk about it with you today.
Excellent, thanks. So Ingrid, to get started, can you tell us a little bit about Prime Therapeutics?
Sure, Tom. We are the biggest little company no one has ever heard of. We manage about $15 billion in drug spend annually. We have 23 million customers, as you said, and we've just tapped over 3,000 employees. We're located here in Minneapolis-St. Paul, and it is not snowing yet, thank goodness, although I hear it will be tomorrow. But here at Prime, our purpose is to help people get the medicine that they need to feel better and live well. And I am proud to say we've got 3,000 employees who come to work every single day in order to help us execute on that purpose. So great company to work for and a great place to be at this point in time in America.
Great. Thanks for that backgrounder. So now that we're a few months away from consumers shopping more freely for healthcare insurance, how would you characterize the level of preparedness among insurance companies?
So you know those bell charts that start off at the very, very bottom, far back left corner at like 0 and then spike up to the super top middle of the bell and then drop all the way back down to 0 again on the far right-hand side? That's the picture I would paint for insurers today. I have lots and lots of people that I have the pleasure of working with across the nation, whether they're regional carriers or national carriers, and I got to tell you, it is all over the board. There are companies that are like, we are hot damn ready, let's go. You know, we've got everything set, we are ready to roll, and then I've got people I've talked to who are like, yeah, we're just not paying attention in 2014, we're going to start paying attention in 2015 because we didn't spend nearly enough time getting ready. So it's not a clean answer. We are really all over that smatter board as an industry.
Yeah, I'd imagine that would be the case. So as we look ahead, what would you say are the key customer experience considerations for healthcare insurers as we move into a more consumer-focused market?
So this is a fascinating time for us, right? And I like to be the person who's as far out into the future as I possibly can be on this one. That's always been my role since I started working in healthcare about 10 years ago. I think one of the stories I like to talk about is you have to think about this like you're walking into Nordstrom's or Target or wherever you buy your jeans. And you walk in every single day and you're looking for a pair of jeans and never do they have your size or the color that you want. And what happens eventually is that you just stop going to that store. You do give up. And we are entering into a relationship with the consumer where if we keep saying no as a way to make money, they're going to go look somewhere else. And I think that is going to be one of the biggest considerations that we're not necessarily prepared to deal with. Historically, this industry has managed cost by limiting services, looking for the best outcomes, finding the best places to drive our members to. But in a lot of cases, we've had to say no in order to do that. And as we know, in this new world, the customer, the consumer, whoever you want to call them, they are always right. And if you don't give them what they want, they're going to go somewhere else.
Yeah, it sounds like it's going to be a real sea change for insurers. So Ingrid, what would you offer as some recommendations for healthcare insurers as they explore how they should be approaching the customer experience? What should they be thinking about?
You know, I think it's really interesting in this industry more so than anything else I've ever worked in. I've been in packaged goods and financial services and some other employee services as well. And in all of those industries, we've been very pointed about which customer do we want and how do we design experiences in order to meet the needs of that customer. It's that whole targeted customer maximizing lifetime value of a segment. And historically, in healthcare insurance, we've really done a one-size-fits-all design and forced everybody, right? Even those square pegs have been forced into that round hole. And I think one of the biggest things that we all have to immediately start acting on is the fact that there's a myriad of segments out there. We have to determine which segment best matches the value proposition that we offer as a company, and then really design for that segment. Some of us will be the Nordstroms. Some of us will be the Kmart. It's not that one is right and one is wrong, but we have to decide which retailer we want to be when we grow up.
Yeah, that's great advice. Thanks. So what do you anticipate will be the most common customer experience gaps that healthcare insurers will need to address, at least in the short term?
Oh, goodness, this list is pretty long, Tom. I can't lie. We as an industry have spent an awful lot of time kind of staring at our belly buttons and saying, this is the right product or this is the right service. And very few of us have spent the time to actually ask the people who are using those services whether or not it's the right service for them. I like to talk a lot about this theory of narrow networks, which is you can get a very low-cost offering, but there's only a very small amount of doctors you can go to. And I think that one of the things that we have to get much better about quickly is being able to be clear in explaining why this is the lowest cost option. We see more buyer's remorse in this industry than any other industry out there. And it's primarily because we're not very clear about the product and solution offering that you are purchasing as a person. So if you tell me you can only go to 10 doctors and that's why this is only going to be $20 a month, that's going to actually give me a different lens as I make the decision. I think the place to start for everyone is all going to be around what is that offering for the different metallics, what is that offering for the different metallics, and how clearly can we articulate what those offerings are. Otherwise, the amount of buyer's remorse and churn we're going to see after that, it won't matter what we do post-enrollment. If we can't nail it with the right product to the right person at that moment of choice, the rest of the customer experience gaps are completely inconsequential because people are going to leave because they don't like what they bought.
So it sounds like it'll have to start with much clearer customer communications.
I think it's clearer customer communications. I think it's clearer tools to help me make the right decision for me. I think there's a huge opportunity to help people make that decision, and we've been reluctant as an industry to really go there, right? I think about financial services where we took the dive in, 1995-ish to say, hey, Tom, this is the best retirement plan for you. And we just haven't done that yet in healthcare, but it's what people are asking for.
Right. So, Ingrid, what would you cite as the top technical challenges that healthcare insurers will have to address internally in order to succeed?
It's interesting, Tom. I've done lots of consulting work with a lot of health plans, and once again have spent tons of time talking to my peers across the industry. And I think one of the things that we as an industry are really far away from doing well is managing our data appropriately and being able to use that at a member or consumer level. So in many cases, we don't know if you have come in and out of our plan 6, 7, 8 times. We all struggle with figuring out if you're Kathy or Kelly or Kay, if you've changed your name or your surname, matching you back to who you were 2 years ago. And I think that one of the things that, I love to talk about American Express and the fact that you can leave Amex and you can come back years later and they will say, welcome back, Ingrid Lindberg. You were a member in 1991. We're delighted to have you back. And we just don't do that well as an industry. The kind of side problem of that, Tom, to be very frank, is we have an enormous amount of data. And the way that we use it, we have to be so careful about. I like to talk about it as, I call it the ick factor -5, right? Because frankly, what I know about you is probably a little scary for you. I mean, I know all the medicines you take. I know all the procedures you've had done. I know everything about your family. And if I start looking at financial data, I know whether or not you bought a pack of cigarettes yesterday. So, we've got to get really smart fast about how we can balance what we know with personalizing services to you without crossing that ick factor line. Does that make sense?
Absolutely, yeah. And I would imagine, too, that it's something that healthcare insurers will have to look at more closely, not only in terms of addressing the customer experience and personalizing it, but also in terms of evaluating the potential profitability of individual customers as well?
It's interesting, Tom. I was talking to some friends of mine at a big three consulting firm, and they have all just started doing work with insurers across the board, trying to calculate lifetime value at the customer level or at the consumer level, right? We've always paid so much attention to retention at the plan level for those employers, right? You want to nail a big account, you want to keep that big account, you want to keep those members happy and keep them for years. Well, all of a sudden, you might have 7 jobs in your lifetime. Maybe that national account isn't nearly as important as Tom Hoffman is. And how do I capture Tom Hoffman and keep him, right? How do I capture and keep him?
So, Ingrid, we were talking about some of these technical challenges, including data integrity and data matching. What do you see as some of the greatest internal cultural challenges that insurers will need to address in order to operate effectively?
Healthcare is a really interesting beast, Tom. It is a really interesting beast. Longest tenures in industries sit in healthcare. You have people who have worked for these companies for 17 years, 27 years. I'm always the odd one out as I come in, and I was like, yep, I've been here for 2 years, and I was at my last employer for 4, and people look at me like, wow, you've jumped jobs a lot, and it's very pervasive in this industry. And I think that one of the biggest cultural challenges all of the insurance companies are going to face is the clash between all of the new talent that is being brought into these firms from other industries, right? Everyone is poaching from retail and finance and consumer packaged goods, and these 27-year tenured employees who have made the company what it is today. And finding the balance between those two islands of people is going to be so incredibly important, because you need the knowledge of the people who have been there, who have made you who you are today, but you have to have the new thought process of those external thoughts. And that is the biggest cultural challenge that I see. If not even we're making a move from serving a client to serving a member, it's not trying to become consumer-centric. It really is the clash of the proverbial titans of the old and the new in a firm that's going through massive change.
It's very interesting, especially given the way you laid that out, the long tenure of healthcare employees relative to other industries. So as we also think about the actual care that customers anticipate and expect to receive, they have some pretty lofty expectations, as you know, for receiving top-notch care. So what are some things that healthcare insurers should bear in mind and put into practice as they consider this?
If you look at the consumer today, they expect what I want, when I want it, how I want it. It's my channel, it's my choice, and it's my time, right? If we are not creating ways to give time back to our customers, we are going to lose our customers. And the translation I would put there is, we have historically laden process after process on top of each other, right? You have to do this, you have to do this step, you need to do this. And what a consumer expects is that they're paying us to do all of that for them, right? They are paying us to do all of that for them. One of the best examples I can give you is I have USAA for my personal insurance. I got a chip in my windshield not that long ago while driving down a freeway, and all I had to do was call USAA. I told them where I was going to be, where my car would be, and seamlessly, Safelite Auto Repair came out. They replaced my windshield. They did everything. I saw not a bill. I had to not schedule a call or a setup or an appointment or anything. It was completely seamless. And that is the expectation that we're looking at. That and full transparency. If I'm paying for it, I want to know exactly what I'm paying for, down to the penny in some cases. You have people who are out there who want to understand why an Advil costs $24 at a hospital stay instead of $4.80 for an entire pill bottle of it at Target, right? So between the what I want, when I want it, and how I want it, and that full transparency to everything we do, I think those are the two biggest challenges we're going to see from a difference in what people expect of us. versus what we actually deliver today.
Yeah, it'll be interesting to see how that transition goes. So, Ingrid, you were talking before about data, and I'm wondering if you can offer our attendees some recommendations for gathering and acting on customer feedback. What are some of the types of data sets or areas that insurers should be paying attention to?
It's really interesting to me, Tom, because having been in insurance now for a while, one of the things that I see every time I go into a new firm is that it's whoever screams loudest seems to rise to the top. And when you are just responding to that type of noise, you're never finding the true root cause. And I see so often that people put into place rapid response teams and they throw bodies at a problem area once they've identified it without getting into the nitty-gritty of what's driving that issue. So when I think about customer feedback, it's not just market research, right? Market research for me accounts for about 10% of my Voice of Customer program. It's constant unstructured social media monitoring. It is constant live call listening. It is constantly holding focus groups and live panels and consumer interaction panels and just always asking and listening and asking and listening and remembering that in a lot of cases, what your customer is asking for is probably just a pain point that you've caused that they want you to fix. You're still not finding, unless you really step back and look at all of it in aggregate, you won't find what people actually need, but they don't know how to ask for. And if you can figure out what that magical bullet is, that's how you create the long-term loyalty, not in the quick fixes, quick rapid responses, acting on customer feedback at every turn.
Yeah, those are great points. And as you pointed out, there are so many different techniques that are available, not just to healthcare insurers, but to all different types of companies to gather and act on customer information nowadays with social and so forth.
There's so much information, but there's very little listening, right?
Well, there's that too. So, Ingrid, for healthcare insurers that are behind the curve on this, can you offer some recommendations for getting started with these efforts?
You know what, I've got kind of my top 5 list that I think is pretty darn important. And it's not easy, guys. I think that's the thing that people forget or take for granted. What I always say you have to do first is define your purpose. And your purpose as an enterprise has to tie to your brand. It just has to. But everyone needs to know what your purpose is. The second thing you have to do is you actually have to determine if you can deliver on that. Because saying it and not being able to deliver on it simply makes you a brand myth. And consumers know that immediately, and they will run away from it. The third thing you have to tackle is really, is your organization ready to make that change, to deliver on it? Because I can guarantee you that there's probably not a single one of us out there who can say, yep, we've defined our purpose, and yep, today we can actually deliver 100% on it. They're always aspirational, right? But the real question is your organization ready, and are they committed? Are they committed to delivering on it? The fourth thing I tell everyone to do, and this, sits up there with number 1 too. It's kind of hard because they're not necessarily always in order. You've got to listen to your members and see if their needs actually match your brand and your purpose. Because if your brand and your purpose are absolutely wonderfully aligned and you can deliver on it, but it's something nobody wants, then what the heck is the point of being here, right?
Absolutely.
And then last but not least is you really do have to paint a path to the future, right? It's not just where are you trying to go. You have to help your organization understand every single step that you all are going to take in order to get there. I so often see firms across all industries say, there's my aspirational picture. That's my customer experience of the future in 3 years. And they never, ever can get there because they don't help the organization understand what the path is to physically getting there. That step-by-step process.
Well, Ingrid, thank you so much for both these tips as well as everything that you've shared with us so far. And, at this point, we'd like to jump into the audience Q&A. But before we do, a few reminders. If you'd like to, we'd like to encourage everyone to participate in the survey that's posted during the Q&A period. So please take a moment to participate. Again, to do so, you'll need to turn off your pop-up blockers to enable the survey. So let's jump into the Q&A. To ask a question, you need to click on the red Q&A icon, type in your question, and then hit send. And if we don't get to your question today, we'll email you a response. So Ingrid, this first question is this follows. Can you offer some recommendations for obtaining leadership support on investments and programs that are focused on customer experience?
Oh, goodness, Tom. That is probably the biggest age-old question out there, right? And you could insert anything in that on customer experience part, right? It could be on product or on employee resources. What I have learned, specifically being a practitioner of customer experience, a story I will tell is I was having a conversation with a CEO at a prior employer, and I was making a pitch for taking a broader portion of the portfolio to be spent on customer experience initiatives. And he looked at me and he said, well, Ingrid, everybody wants a broader portion of the portfolio. You know, why should your initiatives come to the top? And I said, because they're not my initiatives. They're the initiatives our members are asking us to do. And I think there's something very humanizing. The closer that you can get your executive team or your decision makers when it comes to your expenditures to the person you're serving, the more willing they generally are to help you fund those changes. I've done things like live focus groups. I've done things like live executive call monitoring programs. But the closer that you can bring our top-level executives to the people you serve, bridge that gap, bridge that gap. I was working at a firm once, and I was talking about cost, and it was a total packaged goods firm talking about the cost of a product. And this person looked at me and said, well, why couldn't I just go buy that product? That's not too expensive. And I looked at him and I said, you make $14 million a year base salary. There's nothing that's too expensive for you. And then I started talking about the person who cut his hair. And it was a fascinating moment that really brought home for him that he was in a different situation. So you have to figure out how you can bridge that gap between the reality of the decision makers and the reality of your consumer.
All right, great, thanks. So, I think we've touched on this next question, but now we're asking it more directly. For healthcare insurance companies that fail to adapt to the new environment, what are the potential ramifications?
Oh, Tom, this is such a dangerous one. I spent years in financial services, as many of you know, and whenever I'm asked this question, the example that I give is, if you think about the companies that offered pension services back in the late 80s and early 90s, and then defined contribution came along, and everyone moved to 401ks, I will tell you in retrospect, not a single one of those defined benefit or pension firms are still in existence today. They all either sold off that portion of their business and transformed the remainder, or were literally eaten up by someone else who understood that the market was changing and that they just wanted an asset and that the model that sat in that asset wasn't something they were interested in. There's not a single one that's still out there. So I think at the end of the day, the case for change is if you don't change, you won't be here because someone else will figure out how to change and the consumers will notice that. And I think even more importantly, our biggest competition are literally those plans that aren't even open yet. It's the little tiny startups that we have no clue are out there, and they're going to pop up and change the way that we do business.
Yeah, those are great points. I think we've all seen that type of disintermediation occur in other industries as well. So unfortunately, that's all the time that we have today. The 30 minutes goes quickly. But I'd like to thank Ingrid Lindberg for sharing her fabulous insights with us today. And thank you all for joining us. Unfortunately, since we have run out of time, any unanswered questions will be addressed by email. This concludes the Affordable Care Act, Competing for Customers, a Take 30 with one-to-one webcast sponsored by Teletech. On behalf of the entire team, thanks for attending and have a great day.